Good afternoon, everyone, and welcome to Working with VA Medical Centers, a closer look. First thing we're going to do is do a little housekeeping review. So let's take a look at some tips. First of all, you will be listening to this session through your computer speakers. There is no phone call number for you to use. If you're having a little trouble understanding through your speakers, just click on the closed captioning logo, which is on the left of your screen. You can see it in the box on the left, and that'll help you to follow along a little bit better. If you have a question, please type it into the Q&A screen, which is on the left. You just click on that little Q&A button. And what we're really happy about is we'll answer as many questions as we can through the course of this webinar. But if we can't answer a question, we will get it back to you through the Veterans and Military Families booth in the exhibit hall. And you can also continue the conversation, through the forum, which is also a button that you can click underneath the content section. So let's just take a quick look again at these buttons on your left. You've got the closed captioning button, and at the very bottom on the left you have a Q&A button. On the right you have a button that says content, and if you would just click on that right now, you can see that a little menu rises up. The first one is for forums, and again, this is where you can have a conversation with your colleagues about this and other veteran and military family topics. The summary, which is in the middle, is basically a description of the session. And then if you click on the file section, you'll find some of the resources that we're making available as a result of this conversation. We'll be referencing those files during this call. So you'll see, for example, 2 memoranda of understanding, and you'll also see some photographs from some of the events, the Welcome Home event and other events that one of our presenters will be talking to you about. So again, take a look at that and click on that when you need it. The other thing I wanted to mention to you is that we will be, the PowerPoint slides are under the content button too, and we will be making the PowerPoint and the session available to you at a later date. So if you would like to make your screen a little bit bigger, if you take a look at that square where the screen is located, and on the bottom right, you'll see that there's an icon that has 4 little arrows that go outwards. If you click on that, that'll make your screen bigger as well. If you do have a challenge technically, just enter that question about your technology into the Q&A, and someone from CCI will get back to you individually. Okay, so the questions that are technical will be handled individually, but the questions that are about veterans and military families that are applicable to this broadcast will be handled by us or put into the booth. So let's move forward here. Why are we here? We hope that as a result of this session, you'll be able to start some contacts with your local VA hospital or medical facility if you don't already have a relationship with them. We hope that you'll be able to talk about placing volunteers at VA, what they will have to do. Also, we would like you to understand the importance of placing a representative on the VA Volunteer Service Committee, and we want you to have enough confidence to start this partnership at your level. And the way we're going to do this is, first of all, we're going to look at the big picture about why this work is important. Then we're going to dive down a little bit into working with the VA medical facility in your area, and Teresa Long, who is one of our presenters, is going to give you a little bit of an overview, and then we're going to go down to look at the nuts and bolts by listening to eavesdropping, basically, on a conversation with 2 of our RSVP project directors. We'll take some questions after that. Then we'll come back out again and look at the role of a VA-VS committee representative. And again, we'll start with a big picture overview. Then we'll have our project directors talk a little bit about it, because one of them actually is a VA rep. And then we'll get some questions and answers and move into some of the resources that you can use to do this work back at your state. So let's take a look at who we have with us. And would you please push up the poll for us? You should right now have a little box on your screen that gives you a question about whether you work with a VA medical center And after you enter your response, you click your response and submit it. A second question will come up, and there are 3 questions altogether. Okay, so let's see. We want to get a sense of who all works with the VA medical centers, or what percentage of our folks do. And would you push out that poll, please? So you can see that about 67 folks said yes. That's excellent. We're very pleased to hear that. Okay. So we're going to hear right now about the big picture stuff from Teresa Long, who is the Oklahoma State Director for the Corporation for National and Community Service. Teresa has been a state director for about 9 years, and before that, she was actually a VISTA director and an AmeriCorps director, so she's got a very wonderful perspective on all of the national service work. Most importantly, she's been involved with veteran and military family issues her entire life. She comes from a military family background. She is a VA volunteer and has been for a long time. She's a lifelong member of the American Legion Auxiliary, and she's also, very importantly for us, the state office liaison for veterans and military family work and experience. She is, in a sense, the person that we go to when we have questions about veterans and military families here at the corporation. She is a deputy representative for the corporation to the National VA VS Committee. So she's an important person for you to know when you are thinking about becoming a rep yourself. So what we'd like to do now is just turn it over to Teresa a little bit to hear some of the background. Teresa?
Thank you, Margie, and good afternoon, everyone. Again, thank you for taking time to join us on this session. As Margie said, our intent is to hopefully give you some additional information regarding VA voluntary service and potential volunteer opportunities that may be available for your program. So first off, let's talk about why is this work important. The landmark Kennedy Serve America Act charges the Corporation for National and Community Service and our partners to focus on critical national issues and expand opportunities for Americans to serve. In addition to expanding our existing programs, the legislation also creates new initiatives to help increase service opportunities and strengthen our civic infrastructure. Building on the foundation of our national service history, the corporation's 5-year strategic plan provides a roadmap for implementation. Our strategic plan further details the specific objectives, strategies, and the performance measures that will determine our success. In relation to veteran military families, the agency's commitment is twofold. First is to tap the skills and leadership abilities of veterans to serve in Senior Corps and AmeriCorps, and then also to expand the range of services programs are providing in service to veterans and military families. Each year, more than 500 Senior Corps projects and over 8,000 volunteers are serving at Veterans Affairs facilities. Some of the activities that they're doing is assisting elderly and disabled veterans, helping military retirees acclimate to life after service, and providing transportation to those in need of medical treatment. The new agency-wide performance measures will allow us to assess the results of these programs and also expand our ability to account for the contribution of all grantees, sponsors, and partners. Your program can support the goal of providing services by placing volunteers at VA medical centers, which is what we're going to talk a little bit more about today. And you can then take this step one step further by as a representative on your local VA service committee, and we're going to hear about that as well. So I want to start with reviewing some basics from the last webinar that we did. If you had a chance to participate on that, we did a webinar on kind of an introductory webinar on the Department of Veterans Affairs Voluntary Service, or VA-VS program. And VA-VS operates one of the largest federal government volunteer programs. Volunteers supplement staff in all areas of patient care and support. These services that volunteers are providing are for supplementing only and not for replacing VA staff. Even though they work side by side in many areas with staff, they're not there to actually replace staff activities, only to supplement. Volunteers are not permitted to participate in or conduct any type of program for patients that is independent of VA direction, control, or supervision. So when your volunteers are active at a VA medical center, they're actually falling under the supervision of the VA staff at the departments to which they're assigned. So when you're working with VA Voluntary Service, usually the program manager is going to be your main point of contact. This individual is responsible for the overall administration and operation of the facility volunteer program and is the authorized official for all volunteers. Generally, volunteers are going to fall into two different categories: regularly scheduled, meaning that they have a regular ongoing assignment, or occasional. And these individuals might only volunteer at certain times of the year or during special events as needed. Each VA medical center is responsible for volunteer orientation and training, so there may be some variations on what is provided at different locations. However, they'll generally include some of the same components, but they may vary on how they provide it and some of the information that's included. One of the big components of the VA-VS program is volunteer recognition. Volunteers are eligible for various awards, recognition certificates, and service pins based upon years of service. They also may be eligible to receive meal vouchers if their service is at least 4 hours in duration. And again, as with the training, the benefits are determined locally, and so they may vary from one facility to another. Now I'd like to turn it back over to Margie, who will introduce our next speakers, and they'll be sharing their perspective on working with VA-VS at the local level. Margie?
Great. Thank you so much, Teresa. We are really grateful today to have two very special RSVP project directors with us. They're going to help us to put into practice or operationalize the big picture information that Teresa shared with us. With us today, we have Paula Wright, who is an RSVP director from Phoenix, Arizona, and LaRue Johnson, who is an RSVP director from Amarillo, Texas. So I'm going to ask first Paula and then LaRue to talk a little bit about yourself and your program. And first we'll start with Paula and then move to LaRue. And then I'm going to invite you all to join me in eavesdropping on their conversation because there are some wonderful things going to happen. Okay, Paula?
Okay. Thank you, Margie. And hello, everyone. And greetings from Arizona. As Margie mentioned, I am the RSVP director for the Maricopa RSVP program, which is sponsored by the Area Agency on Aging, Region 1, located here in Phoenix. In Maricopa County, which is the largest county in our state. And our RSVP program has operated for about 19 years, and I have been in the position for a little over 2 weeks now, so I am a newcomer to RSVP. We currently have 40 stations and approximately 200 volunteers, and our volunteers are serving in the areas of supporting seniors, food security, public safety, advocacy, mentoring, and veteran services. Our veteran station is the Phoenix VA healthcare system, and this system consists of a main medical center and outpatient healthcare clinics throughout the valley. And currently they have about 1,100 volunteers serving and just 2 paid staff in their voluntary services department. And the volunteers are serving in many roles. They serve in the retail store. They work at the information desk, greeting visitors and offering directions. They serve in administrative and clerical roles. They also serve as escorts, escorting wheelchair patients to various locations in the hospital and picking up and delivering charts to different locations. And they also have many volunteers who are serving in a professional capacity. So they're serving as physicians, phlebotomists, lab technicians, radiation techs, and EMTs. So that's just a little bit about my program.
Thank you very much, Paula. That's very helpful. LaRue, can you talk to us a little bit about your program?
Yes, I can. Hello, Paula. I'm LaRue Johnson, and I'm the director. I'm the director of the Amarillo, Texas Panhandle RSVP project. In 1995, the director of RSVP called me to see if I would like to volunteer with a new program they were getting ready to start in the Panhandle, and I did volunteer and later became an advisory council member, and then I went to work for the program 10 years ago and was promoted to director 5 years ago. My project is in Amarillo, Texas. It's 39 years old, and this project covers 11 counties in the Panhandle. We cover 10,679 square miles. We have 123 volunteer stations with 1,426 volunteers, and last year they turned in 243,449 hours. This project has 36 registered veterans. 23 of them serve at the Thomas E. Creek Veterans Health Facility here. The Amarillo VA Center has the hospital and 3 clinics and 2 vet centers. Panhandle Community Services is my sponsor and has been my sponsor for all 39 years. It's a community action agency covering 26 counties. Panhandle Community Services has the BASH program here in Amarillo, which is the HUD Homeless Housing Program, and right now they have 60 vouchers issued. They do the HUD Rental Assistance Program. They do Weatherization and Energy Efficient Appliance Program, Utility Assistance, Families in Training, and the Panhandle Transit provides rural transportation over 26 counties with curb-to-curb service. And that's my project.
Thank you so much, LaRue. I'd like to just take a second to remind folks that on the left of your screen you have a CC icon for closed captioning. If you're having any trouble hearing, if for any reason your speakers aren't clear or we're not clear, please do feel free to click on that, and that way you'll have this conversation in front of you. And also to remind you that there's a Q&A link on the left, and there's a content button, or content bar, I should say, on the left. And if you click on that content bar, you'll see a section called Files. And if you go to those files, you'll see the MOUs that both Paula and LaRue have with their VA medical centers. Okay, again, if you go to the content section, you'll see the MOUs that are in place there. So we've got a brand new person, and we've got someone who's been doing it for quite a while. How about if, Paula, we hand it back to you, and meanwhile, we'll sit back and listen in on your conversation.
Okay. Well, LaRue, since I am fairly new, I think I represent the perspective of those programs who are just getting started. So I'd like to start out by asking, why did you decide to work with the VA?
Well, the VA hospital here, it's local, and it's one way for those of us to volunteer to give back to those who have served your community. I'm also an active member of the VFW Auxiliary, and I volunteered at the hospital myself. The VFW Auxiliary does bingo at the nursing home and at the hospital one evening a week. And I've also worked with the American Legion program, which is the Christmas cantina and the Christmas party at the VA hospital.
Oh, that's great. That's great. So tell us, what types of things do your volunteers do? What kind of roles do they serve in?
Well, as was mentioned already, our volunteers only serve in non-professional roles. But here's some examples of what they do in our hospital. They escort the ambulatory and the wheelchair patients around the hospital. They deliver medical charts. They answer the phones. Staff the lobby's information desk, giving people directions where to go to. They serve as greeters. We have some people that help fill prescriptions in the pharmacy. And they shuttle patients who come in to and from the different buildings that are at our VA center. They volunteer and garden with the vets at the mental health unit. And they do the special events, which means they only volunteer not weekly or monthly, but just when we're having a special event. And that's like for the holiday activities, the welcome home that we do at the VA, the stand down for the homeless veterans, bricklaying, and other special projects that go on out at the hospital.
Oh, that's great. And then the special events are a really great way for the volunteers to get to know the VA, and a good way for VA to get to know RSVP, too, I believe.
And I know that some of our younger volunteers that have just turned 55 don't want to volunteer on a regular basis. So being able to volunteer for special events makes that work very well for them.
That's great. Really good.
Paula, can I just interrupt for a second?
Sure.
I just wanted to again mention the content button on the left, because if you go to the files, you'll see some really nice photos of the Welcome Home event that LaRue was mentioning. So again, you'll see some nice photos there to illustrate some of the things that LaRue has been talking about. Thank you, Paula.
Okay, sure. So LaRue, how did your volunteers actually get started with the VA?
Well, when I came to work for VA, this RSVP program was already a station there. But as the volunteer coordinator, I was a new person on the block, so I made an appointment with the VAVS program manager and the VAVS volunteer coordinator and introduced myself. I also went and talked to the director of the hospital and introduced myself, and just started to build a relationship. I also, when I became the volunteer coordinator, I had to go through the orientation training at the VA. And so after I went through the orientation training, I talked to the program manager about the possibility of someone from the RSVP office coming to their volunteer orientation and talking to the volunteers and hopefully enrolling them in the RSVP program. And they do orientation once a month or every 2 weeks if they need extra volunteers. So that's a good way to start a conversation with the volunteers and get acquainted with the new volunteers just a few at a time.
Yes, that sounds like an excellent way to get started. So again, in your case, you were the VA was already a station. So in the case that the VA isn't already a station, how would you recommend people get started then?
Well, I think the first thing you need to do is make an appointment, talk to the director of the VA facility in your area, explain to them that this is a national project. We sit on their national VAVS board, and then make an appointment, talk to the volunteer services, explain what RSVP is and what you can do for them, because I don't know any organization that can't use volunteers.
Right.
Offer to help with events and stay in touch. And if they're not interested to begin with in making you a station, then talk to them about special projects that you could do and begin to build a relationship with that hospital. And I think it's important that you explain to them about our insurance and that we report all their volunteer hours to the state and national programs that go on in our country.
Okay. That's great. And when you say if they're not interested in becoming a station, you can talk to them about special projects. It's like service projects that you can send your volunteers out on. Is that what you're referring to?
Yes, or you may have a project already that would fill a need that the VA has.
Oh, okay. Okay, that's good. And do you need a special MOU, a Memorandum of Understanding, to work with them?
No, we just use our regular memorandum of understanding. They sign a memorandum of understanding with us every 3 years. And
okay. And so how does an RSVP volunteer who's not already serving at the VA become a VA volunteer? What's the process for that happening?
Well, if a volunteer wants to serve at the VA, well, first of all, most of the volunteers that we personally place at the VA calls our RSVP office looking for some place to volunteer. We set up an appointment. They come in. We go through an interview process with them and do some screening, figure out what they would like to do. And then if they're interested in being a VA volunteer, we call and set up an appointment for them with the VA. And now, if we can't get a hold of the VA right then we take their information. We call the VA, set up an appointment, let the VA know that we have a volunteer that's interested. Let the VA call the volunteer and set up the appointment, because you don't want to send a volunteer out to the VA and everyone's busy and no one can talk to them.
Right.
So then after the appointment is set up, they go meet with the VA, talk to the volunteer coordinator out there. She talks to them about what they need. You can also, at that point in time, direct them to the VA website, which has volunteer opportunities. It also has a need list. The volunteer chooses the role that they want at the VA hospital, and then they agree to go through participate in a 4 to 6 hour orientation based on the roles, and then they are scheduled for that orientation, and they call us back, and we go to the orientation, get acquainted with the volunteers, present RSVP, and hopefully they will agree to be one of our members. One thing I think that is very important is you need to remember that you're dealing with military people, and this is a different culture than what we normally work with.
Right. Can you talk a little bit about the culture?
Well, most of them, not everyone, but a lot of the VA are retired military. So they're used to a very structured way that they do everything. And if they have a program set up for volunteers, they may not, to begin with, be interested in taking on another program because they feel like it's going to be, for whatever reason. Maybe they think it's more work or whatever, but the difference is they're used to the structure coming down from someplace else telling them, this is the program we're going to work with, and this is the way we're going to participate, and this is what's going to happen.
Okay. Well, this is all so helpful, LaRue. Can you tell us about a success that you've had with the program?
Well, one of our big events is the VA's Welcome Home, and the Welcome Home is a mandate for most VA hospitals, and it's a benefit fair. They invite locally we invite 2,500 people to come to the benefit fair. It's after the Veterans Day Parade. Everyone's invited to come to the VA. Last year we had about 2,000 to 3,000 people. RSVP had a booth there where vets could pick up information about volunteering, not only for us, but volunteering in the community. We had volunteers that ran the registration. We had volunteers that promoted the event on TV and radio. Our name was on the flyer as a partner. It's at the VA, in front of the VA hospital, and it's after the local Veterans Day Parade. And it's kind of for the Iraqi and Afghanistan veterans, but here it's open to any veteran or anyone in the community that wants to come. We have a lot of people. I think we had 30 booths last year. United Supermarket did the food, and we had between 2,000 and 3,000 people attending, and we served them hot dogs and hamburgers.
Wow, that does sound like it was a real success. That's great. I know you probably had challenges as well. Can you tell us about a challenge and, how you dealt with that challenge?
Well, I think one of the big challenges for all of us is getting the volunteers to identify with RSVP, because the volunteers will think that they're VA volunteers, which they are, but they're affiliated with us. And that's where you have to establish a relationship with the volunteers. If you go to the hospital to do something, you need to talk to the volunteer. You need to look at their name tag. You need to call them by name. You need to introduce yourself. You need to talk to them about what RSVP is and if they're a volunteer. We need to take time to attend their appreciations, whatever they are. We need to invite them to our appreciations. We need to send the new volunteer the newsletter, send them any other kind of information on anything that we have going on that they might be invited to personally, such as something that's happening in our office or some kind of a workshop we might sponsor or something like that. And it takes time. You have to be reliable and you have to be visible. And then I think along with that, we have to talk about keeping volunteers active and engaged, and we send out a quarterly newsletter, and each issue we recognize a different agency. We go to as many functions as possible and hopefully make ourselves visible out there in the community. We all know that volunteers only have X number of hours, and they chose this organization to work for. So we have to be sure they feel like they're appreciated with what they do, and so that they will stay with the organization and be dedicated volunteers.
Well, all of those are excellent tips, LaRue, and I find as a new director that I'm seeing that that's been a challenge for our program as well. And what I hear you saying is it's all about relationships, establishing those relationships and staying connected with RSVP volunteers. So those are excellent tips. And I just had a question about your newsletter. I know you have a large volume of volunteers, and I'm just curious if your newsletter is electronic or are you doing hard copies or?
I do hard copies because I cover 11 counties, and we post our newsletter on our PCS website page. But a lot of my counties only have dial-up, and some of them don't have computer service, period. And some of them don't have cell phone service. So I know in some of the larger areas that's not a problem, but in some of my areas it is.
Okay. So looking back, what do you know now that you wish you would have known when you got started?
Well, like I've already talked about, it's important to be visible and reliable. When a volunteer can't do something, fill in that position with the staff. I didn't know when I first started that you could go to the VA website for volunteer information and for a needs list. That the volunteers can help short-term or regular volunteers. A community network where that you go out and mention projects to other organizations that the VA needs. An example is we have a community house where if someone comes into Amarillo and they weren't expecting to have to stay and have tests made another day, it has 12 bedrooms and they can use the community house. Well, the community house, the VAVS stocks it, puts all the things in it that are necessary to make that project work. So that's one of the things you can go out and talk to other people in your network about the needs of the VA and hopefully make a project a community project, not just a volunteer project.
Thank you so much, both Paula and LaRue. This has been very, very helpful. What we'd like to do, since our Q&A button is jumping off the screen, we're going to take a few of the questions right now that some of them are directly for you guys and some of them are very general. So, Teresa, can I turn it over to you?
Sure. Thanks, Margie. So, again, thanks all of you that have been submitting questions. There's some great ones that are coming in, and we know we won't have time to address all of them, and the ones that we don't get to, we will be posting, as Margie said earlier, we will post those in the Veteran Booth Forum, and we'll be responding to all of them there so everybody can see the responses for that. So one of the first ones that I want to address here is that have any attempts been made to communicate to local VA programs the fact that a partnership with Senior Corps programs exists? And the answer to that is yes. We have been working diligently on the national level to strengthen our relationship with VA and VA voluntary service. And I actually had the opportunity to participate in the National Advisory Committee meeting in Charleston, South Carolina in March of this year. And we have continued to disseminate information out to the local level. We've shared with them, the local program staff. We've shared contact information for the state offices, and VA has shared contact information for all of the local program officers with us. And so we are continuing to reach out for that. But as you can imagine, on a national scale, that information is slow sometimes to trickle down. So if you've reached out to try to make contact with your local VA and they're not familiar with RSVP or Corporation for National and Community Service, again, it's, don't give up, as LaRue, you've heard LaRue and Paula talking about. It's all about building those relationships. And if you're really struggling, feel free to contact your state office, and we can certainly help facilitate introductions if you feel that it would be helpful and beneficial for you on that. Another question is, where do we find information, contact information for the VA program directors? And if you go to va.gov, which is the main website for Veterans Affairs, then under the Benefits tab, you'll see the link for voluntary service. And inside that information, you'll find the database with contact information for all of the local VA program staff. You'll also see information on upcoming events on the national level and other information that may be really beneficial for you as you're trying to make contact on the local level. We also have another question that are any SCP programs utilizing VA as a volunteer station, and the answer is yes. We have several senior companion programs that are working with VA. VA is, in fact, been implementing a respite care pilot program in several locations, several cities around the country, and that list is continuing to expand. And we actually have one example that was provided to this also is that my RSVP volunteers make reminder calls to veterans to help reduce the number of no-shows for medical appointments at the local outpatient clinic. They record the number of appointments reminded since they can't track specific veterans due to HIPAA. So that's one example that for an SCP program that our activities that they're doing. Others, as I said, your local VA, if it's one in your service area, may be participating in the respite pilot program. So that's an opportunity for you. There are also veteran outpatient clinics and state veteran homes that are not part of the federal VA system, but also are providing services to older veterans that can be really in need of SCP volunteer services. Let's see, some of the other ones here. LaRue, this one is directed to you. It sounds like you have a large project. How many staff do you have in your RSVP office?
3. Myself
right.
and 2 others.
Great. And here's
doesn't
one
get much sleep.
And so here's one that I think that Laura and Paula and Margie, you jump in on this one as well. It says, have you encountered any concerns on the part of VA facility regarding liability issues with having older volunteers serving in the hospital? And I would, my response to this is that, I have been involved in voluntary service at the VA my whole life, and usually I was always the youngest one there. In fact, most of the volunteers on site were older. I mean, veteran service organizations are some of the biggest suppliers of volunteers in the VA volunteer system, and those volunteers do typically tend to be older individuals. So in my experience or information that we've heard back from VA on the national level, we haven't encountered any concerns about older individuals serving in the hospital. I mean, certainly there may have certain volunteer activities that may be appropriate for younger individuals, but there's certainly plenty of opportunities that are appropriate and available for older individuals. And Laura, I don't know, based on your experience, if you have anything that you want to share on that as well.
Well, most of the volunteers that volunteer through RSVP at our local facility here are probably 74, 75 years and up. They do have a younger program for teen volunteers and other volunteers, but we basically work with those 55 and older, and most of ours are in their 70s, and that never has been a problem.
Okay, great. Thank you. So I think now we'll go ahead and move into the next part, and then we'll take additional questions at the end. And again, please keep them coming in. Those that we don't get to, we will post in the forum and respond to all of them. So keep them coming. Margie?
Thank you so much, Teresa. So we've kind of gone into the weeds around the volunteer area, and we have lots of great questions and advice about that. Now we're going to pull back out a little bit and look at the big picture again. And as we said in the beginning, Teresa actually is the corporation's deputy representative for the VA Voluntary Service Committee at the national level. So what she's going to do is tell us a little bit about that role for you as a project director. And then we're going to turn it back to Paula and LaRue again, because Paula is interested in learning a little bit more about how one gets to be a local rep. So, Teresa?
Thanks, Margie. So we are, as an agency, very excited about our membership on the National VA Advisory Committee. We are relatively new to this process. We actually were just approved for membership in March of this year. So, we are still kind of getting our foot in the door and developing those relationships and making contact on the national level to provide information down to those local programs. And this was kind of a long process, but we are there at the table now and couldn't be more excited about the opportunity that this presents for our agency as a whole and for you at the local level. So what is the advisory committee? So members of this committee promote the VA Voluntary Service Program, communicate VA policies to their constituents, and make recommendations to improve volunteer services for veterans at VA medical centers across the country. As I just mentioned, we did have the opportunity to participate in the National Advisory Meeting back in March, right after our membership was approved. And during this, the meeting is held once a year, and during that there are recommendations on new policy changes and programs and services that are brought to that committee for approval. And if approved, then they are implemented at the local level. So in your own community on the local level, representatives and deputy representatives serve as the liaison between medical facilities and service organizations to which volunteers are attached. The corporation is certainly encouraging RSVP and SC projects to take advantage of this opportunity to become more engaged locally by placing a rep or a deputy representative on your local VA council. As you heard LaRue talk about her experience, and she'll share a little bit more about that in just a couple of minutes. So volunteers certainly can be placed at a VA facility without having a formal representative or deputy in place. This additional step, just provides an opportunity to strengthen the relationship with VA Voluntary Service and the other committee member organizations that are participating there. And it also provides opportunities for increased programming and awareness and visibility for your program. These individuals are critical to Senior Corps and CMCS as a whole to help strengthen our relationship with VA. And while there is no restriction in volunteers serving in this capacity, Senior Corps recommends that project directors or other staff serve in the role of a representative or a deputy representative because you're most familiar with your program and your volunteer resources and would be most appropriate person to represent the program to other committee members and talk about, and increase the visibility for your program. Some of the basic requirements and responsibilities include, first, you have to be registered as a volunteer. You don't actually have to be putting in volunteer hours, but you at least have to go through the volunteer orientation process, which helps give you some background information on what your other volunteers would be going through as well. And you also, some of the responsibilities are to help develop the relationships strong relationships with the VAVS program manager, as we've heard LaRue talk about, is really essential in helping develop that bond and create opportunities for the program, and also to attend committee meetings. So basically, in a nutshell, the representatives and deputies are providing valuable input on the facility volunteer program and services and promoting organization resources. The process for applying to be a representative is, again, first to have gone through that volunteer orientation process, then submit a written request to Jan Newsom in the Senior Corps office. She is serving as the national certifying official between us and VA for purposes of representatives and deputies. And after we get written notification for that, Jan will then send approval back to the local VAVS program manager, who will change your status in their system to reflect your designation as a rep or deputy representative. Once that process is complete, then your program volunteer data is going to roll up into the overall CMCS and Senior Corps reports from VA. Again, you don't have to, this is just an additional opportunity for your program. It's not a requirement. And your volunteer hours, if you have volunteers serving at the VA and do not have a representative or deputy, your hours still count in the VA system. It just doesn't get rolled up into the report that is attributed to Corporation for National Community Service and Senior Corps. So now I will turn it back over to Paula and LaRue. And you've heard LaRue mention that she is a rep. She serves as a representative at the Thomas E. Creek Medical Center, and she's going to give you some additional details on her experience in this capacity. So Paula and LaRue.
Yes, thank you, Teresa.
Okay, thank you.
I think Teresa did a really great job explaining what representatives do. So I would like to just start out by asking how you became a representative.
Well, I basically inherited the position, and because the previous director here had been a rep, and when she retired and I became director, then I had to go talk to Panhandle Community Services, who is my sponsor, and at that particular time, they had to certify me to represent them in the nonprofit sector. So they did all the things that Teresa talked about, only they were done locally. One thing that if you're a new volunteer someone on the board at the time I became part of the Veterans Affairs Voluntary Service Committee. Someone on that board had to recommend your agency, and then you were invited to participate on that board. And as I understand now, some of that is going to be taken care of by the national project. So that will probably make it easier.
Okay, great. And I assume that there are other groups that are represented on the committee as well?
Yes, our committee here at the present time has 19 organizations. Some of them are military, like the American Legion and the Auxiliary, the AMVETS, the VFW, the Women's Vets, and then we have some that are professional organizations like the Knights of Columbus, the Salvation Army, and then RSVP actually represents the nonprofit sector on that board.
Okay, excellent. Well, I just have a couple more questions for you, and I'll be done. How do you think being involved on VAVS has helped you and your volunteers?
Well, it's a great way to meet other organizations that serve veterans and military families that maybe we wouldn't necessarily come into contact with before. These organizations are potential placements for veterans. Not only your organization and the VA organization, but if you have volunteers that want to do something else, these are great potential places to place volunteers. Through this network, they'll help you find veterans and military families who need some help. You get a lot of information from the meetings and things, and where you give permission for special events and special projects. So you kind of have an insight to go out and better serve those programs and the volunteers as you know what's coming up and what's going to happen in the organization.
Okay, excellent. And then finally, what advice would you give someone who's just starting out as a representative?
Well, back to what I've said before, get acquainted with your VA staff. Ask questions. Try to attend as many of the meetings as you can. I know that they talked about going to va.gov, but here in Amarillo you can go to www.amarillo, or whatever the name of your city or hospital might be, .va.gov, and you can go to volunteer services, and you find out the needs, and there's a volunteer list placed there. There's also a list of needs for both the nursing home, the hospital, and whatever. And, you know, I think we all need to remember that our veterans are facing huge challenges as they try to reenter society. And we really need programs that help in your communities, not only the VA programs, but the programs that help those people like the VASH program or whatever it is that helps those veterans smoothly reenter society.
Thank you so much, LaRue and Paula. Those were excellent questions, and I know I learned a lot. I know several folks on the call have other questions. Teresa, can I turn it over to you to pull up some of those and respond for the group?
Sure. Thanks, Margie. So one that came in was, could we repeat the name of the corporation certifying official? And yes, that is Jan Newsom, and she is Senior Corps Program Officer, staff. And we'll post her contact information in the Veteran Booth Forum so that you have her direct information on how to get in contact with her. Also, we had a question that came in, is that Can you explain again the effect of being a VA/VS rep versus not being one for an individual program? Something about volunteer hours not being counted in the Senior Corps overall numbers. Yes. So in relation to that, if you have volunteers that are serving at a VA medical center, then your hours are counted from that local facility toward and attributed to your local program. And so you can do that, place as many volunteers as you would like, and be involved without going through the next step of having a representative or deputy representative. But what that additional step does is then attach your specific program to the Corporation for National and Community Service, Senior Corps as a whole across the country. So when VA does their end-of-year reporting and they list out all of the hours that have been volunteered and attribute those hours to specific organizations, then the programs that have gone through the process to have a representative or deputy representative, those hours get rolled up into that overall number that is attributed. So it would show Corporation for National and Community Service had, 4,000 volunteers that contributed, 100,000 hours at the VA center. And those would be the ones that are attached to a program that has a VA/VS representative. The other volunteer hours get counted into just their overall numbers that are attributed to volunteer service contributions to VA across the country. So I hope that answers that question, okay.
And Teresa, it sounds as if, too, that supports a little bit about what Dr. Ton was saying this morning in his Q&A and in the plenary. It's a way for us collectively to tell our story. We know that the work our volunteers do is important, but we can't always communicate that with others. But if we can collectively share our story, we'll all benefit.
Absolutely.
One more question.
One more question. All right, let's scroll through here, and I think this one is very appropriate. Paula, with you, it says, "I'm only 2 days new to RSVP. Could you speak to the selling points of RSVP to new duty stations and their volunteers?" So, LaRue and Paula, I think that's a very appropriate one for you to respond.
Boy, that's a tough one. The selling points to RSVP volunteers, I think that one of the things that with national service programs is that people are becoming part of national service. It's not just a regular volunteer opportunity, but you're making a commitment to serve our country. And the benefits of the mileage reimbursement and just the impact that they're going to have in serving the community.
Thank you.
Well,
LaRue, would you like to add to that?
The more volunteers that work on some kind of a project, as one person we can do so much, but as we put a group together, we can accomplish so much more, that it makes it more advantageous to the organization that they're going to volunteer with. And then I think if they become part of the RSVP organization, we can help them with other things that they need, such as training or job descriptions, setting their program up, helping them with any of the things that make a program continue to work and make a program that makes volunteers want to come and work with that program.
I think, LaRue, that is a perfect way for us to wrap up. Not only is it important for us to remember that together we can become so much more, but for each of those individual volunteers, with other volunteers, there's a connection and a sense of community, and we all know how important that is, especially after someone's been working their whole lives, and then they drop out of the workforce or they retire. It's a good way for them to stay connected with their communities and each other. Well, at this point in time, we need to wrap up, and I'd like to refer you to the URL that's on our last slide. It says, for more information about working with VAVS and VA medical centers, visit our booth and the Knowledge Network. And I'd like to invite you all to sign up for the Knowledge Network. It's a community of practice that addresses issues for veterans and military families. And many of the questions that you've raised today about things like finding the kids whose parents are serving, many of these issues are addressed in some of our conversations through the Knowledge Network. So please do visit the booth, sign up. It's a place for you to access research, new materials, each other, as well as a wonderful series of webinars, including one that will be coming up soon on the deeper dive into BSOs. We separated that out from this session because the information was so rich. So do stay tuned for that. And thank you so much. Any parting words from first Paula, then LaRue, then Teresa?
Well, yes, I just want to say that all of the information that has been shared today has been extremely helpful to me as a new director, and I hope it has been to the audience as well. Obviously, LaRue, you've done an outstanding job with your program, and I want to say congratulations to you. And it's been a pleasure talking to you.
Well, thank you so much for allowing us to be part of this presentation. And I hope we've helped someone else with what's available and how to go about making this program work for you. It's a very worthwhile program. You'll really enjoy it.
Thanks, LaRue and Paul. I just want to first off thank you so much for your participation today. You both were fabulous and had such great information to share with everyone, and thank all of you for taking time to participate in the session. To echo LaRue and Paula, we hope that we've given you some information that will be useful as you go back and start trying to strengthen relationships or build programs at your local level. And if there is anything that we can do to help facilitate that process, if you have questions, if you need assistance in any way, feel free to contact us. We'll put our contact information in the veteran booth, and so feel free to contact us at any time. We're happy to provide assistance or help facilitate introductions at the local level or whatever information that we can assist you with. Margie?
Thank you, Teresa. And thank you. And speaking of connection and staying in touch, we'd like to invite you all to participate in a networking opportunity that immediately follows this session. This is the last formal session of the day. It's a great opportunity for you to continue to build relationships with one another and to learn from each other. So that link will appear on your screen, and we look forward to seeing you there. Thanks, everyone, for joining us, and bye now.